Are you currently employed?
I am.
Where?
I'm the dean at the University of Colorado School of Dentistry.
And since when have you held that position?
I started that position July 1, 1999.
Okay. And prior to that time, where were you employed?
I was employed at the University of Southern California School of Dentistry, where I was, where I had various positions. I started that position in 1973.
And in 1973, were you on the faculty?
I was appointed to the faculty in July of 1973.
Okay. And at some point you became the dean of the U.S.
Correct.
Dental School.
Yes.
You'll have to wait till I finish my question because he's going to get really angry at us.
I apologize.
No, it's okay. We'll get it taken care of at the beginning and then we won't have any problems. All right. So when were you appointed dean of the dental school at USC?
I was appointed dean at USC School of Dentistry in January of 1991.
Okay. And did you hold that position from January 1991 till the time you left?
That is correct.
Okay. Were you also teaching during the time you were a dean?
Yes.
And what did you teach?
I taught in a part-time capacity in prosthodontics.
And is prosthodontics your specialty?
It is.
Okay. Okay, when did you first meet Dr. Lazaroff?
I don't recall the exact date when I met Dr. Lazaroff, but the first time I was made aware of Dr. Lazaroff was by Dr. Richard Kahn. And it was a year or two after I had become dean.
Is it fair to say it was about 1992?
That would be fair, yes.
Okay. And what did Dr. Kahn say to you about Sargon Lazaroff?
Dr. Kahn came to my office and mentioned the fact that Dr. Lazaroff had invented this unique implant, and he showed it to me, and I was very impressed with it. Also, Dr. Kahn was an old friend and also highly respectful, who I highly respected, and the fact that he showed me this implant excited me. It looked really unique and very different from any other implant I'd ever seen. Okay. Dr. Kahn.
I think you just answer the question she's asked.
Okay. Well, how did you know Dr. Kahn?
I knew Dr. Kahn through dental school and also as a personal friend.
When you say through the dental school, was he on the faculty or was he a student?
He was on the faculty.
Okay. And at the time he showed you the Sargon implant, was he in private practice or was he still on the faculty?
He was both. He was both.
Okay. At the time that Dr. Kahn showed you the Sargon implant in 1992, did you do anything further with that with respect to talking to Dr. Lazaroff? Or what did you do after that?
I did very little, and the reason, just did very little.
In other words, you didn't really follow up on it. You looked at it and you thought it was interesting, or I believe you said you were impressed by it or something, and then you did nothing.
Correct.
Okay. When was the next time that someone mentioned the Sargon implant to you?
The next time it was mentioned to me was with Dr. Abaras.
Okay. Do you remember when that was?
It was a few years later. I don't recall the exact date.
Okay. Is it fair to say that it was about 1994?
That would be fair.
Okay. And what did Dr. Abaras approach you about the Sargon implant?
Yes.
Okay. And what did he say to you?
He reminded me, well, he said to me that here is this implant that Dr. Lazaroff had developed, and I recalled then my previous conversations with Dr. Kahn regarding the implant, and once again thought it was quite a unique implant.
Okay, that's the word. When Dr. Abaras approached you in 1994, did you do anything then with
Yes,
regard
I
to
did.
the implant? What did you do?
Unlike in 1992, where I really didn't have any leadership in implant dentistry at the school, in 1994, I had now established an area where I had a director of implant dentistry at the school.
Okay. And who was that director?
Dr. Winston Chi.
Okay. And when had Winston Chi become the director of implantology?
Sometime between 1992 and 1994. I don't recall the exact date.
Okay. And did you appoint him to that position?
I did.
Okay. Prior to the time that Winston Chi was appointed to that position, had there even been an implantology department?
Objection, Ms. Stacy's testimony to say an implantology department.
Okay. Had there been a position for a director of implantology?
Yes, there was, but the individuals came and they sort of they didn't stick it out very long, and Winston was, to my way of thinking now, the permanent director and would stick it out for a while.
Okay.
But it was not a department.
Okay. I'm sorry if
That's
I
all right, no problem.
made it a department when it wasn't. So Winston Chi was appointed as the director of implantology sometime between 1992 and 1994, correct?
That is correct.
Implant dentistry, is that the title instead of
Yeah.
implantology?
Implant dentistry is
Okay.
fine.
So when Dr. Abu Ras approached you in 1994, you had Winston Chi there as the director of the of implant dentistry, right?
Correct.
Okay. And so what difference did that make in terms of how you approached the Sargon implant?
Yeah, before you answer, just for clarification, I think you said, would it be fair if we're talking about 94? I'm not sure that you know it was exactly 94. Your questions now are in 94. Again, just assuming that's the right time period.
Assuming
okay.
that's the right time period,
Okay.
and certainly if we're off a year one way or the other, it's not going to be fatal to the testimony. I just want to get as much information as I can from you. But we will note that for the record, that you're not absolutely sure.
Okay.
My question is why was it different? What was different about the fact that Winston Chi was there when Dr. Abu Ras approached you in or about 1994?
By having a director of implant dentistry, it allowed me to say now I have an opportunity to take this implant and take a few people with a director and start a study.
Okay. So at that time, you believed that a study should be done with regard to the implant?
Yes.
Okay. Did you talk to Dr. Abu Ras about conducting a study?
I did.
Okay. And what did you say to him?
I don't recall the exact words that I said to him, but I felt that the implant was so unique and so different than traditional implants that the fact that this implant, if it could do what Abu Ras and others do, the implant would have a tremendous impact on the profession.
Okay. At the time that Dr. Abu Ras approached you, are you aware whether he had placed any implants in his private practice at that time?
My recollection is that he said he had.
Okay.
Yes.
And do you know approximately how many implants he had placed at that time?
I don't recall him giving me a number.
Okay. Was it more than 5?
I don't.
Calls for speculation.
Okay, but if you can estimate if it was more than 5 or...
If you don't have a basis of estimating.
I just don't recall the
Okay.
number, but he did say he had put implants in his practice.
Okay. After you spoke with Dr. Abu Ras about potentially conducting a study, what happened?
We put together a team of individuals, namely Dr. Abu Ras, Dr. Winston Chi, Dr. Hissam Nazari, and spoke about the possibility of putting together a study.
Okay, did you have a meeting with all these people?
Yes, we did.
Okay, specifically to discuss the study?
Yes, correct.
Okay, do you remember when that was?
I don't remember the exact date, but I do remember the meeting.
Okay, where was the meeting?
The meeting was held in the valley at the Sportsman's Lodge.
Okay, was Dr. Lazaroff there?
He was.
Okay. Anybody else?
I don't recall.
Okay.
There may have been someone else, but I don't recall.
Okay, so just to get it straight, there was Dr. Abu Ras, Dr. Chi, Dr. Nazari, you, and Dr. Lazaroff?
Correct.
Okay. Do you recall what was said at the meeting specifically?
There was excitement about the fact that we could do a study with this implant.
Okay.
Relative to specifics at the meeting, I don't recall.
Okay. Well, what was the significance of the implant?
The significance of the implant was the fact that here was an implant that one could put in a patient's mouth and load immediately, and so a patient would not have a long waiting period while the implant healed, and then have to recover, open up the tissue, and put on a restoration. The uniqueness of this implant was it was the first immediate load implant that I'd ever seen or ever heard of, and thought that it was an amazing discovery.
Okay. And at this meeting, did you talk about protocol for the study?
We got into some preliminary discussion of protocol, but to my recollection, did not get into any formal discussion of protocol at that meeting. It was more of a introductory meeting.
Well, did they talk about the length of the study, those types of general things?
I don't remember.
You don't remember?
No.
Okay. So have you told me everything you remember about what transpired at that meeting?
Yes.
Okay. Why did you believe that it was important to conduct a study regarding this implant?
Because if the study indicated that this implant would do what the manufacturer claimed it would do, it would revolutionize dentistry.
In what way?
In a way that an individual who had lost a tooth or teeth could have this implant put in their mouth, and on the same day that they had that implant put in their mouth, could have a temporary restoration put in their mouth, go home, and virtually within an hour's time be eating an apple or a steak or whatever. That would be something very unique.
Okay. And so far as you knew, there was no other implant that could do that at the time?
That is absolutely correct.
Okay. In your own mind, did you have a time frame that you were thinking of that this needed to be tested in order to make certain claims about it?
No.
Did you ever tell Dr. Lazaroff or anybody else that if it performed for a year, or if there was positive results within a year, that would be a significant milestone?
At any time, or have you moved past the first meeting at the Sportsman's Lodge?
Yeah, I'm just talking about generally. I'm trying to get
I just think it's vague because since after that there was then an actual agreement that had a length of time. Now, obviously you can ask about questions that have been, discussions that have been had, but...
No, I'll ask more specifics as it relates to the agreement. But I'm just saying, in your mind, did you have any kind of an understanding or a feeling that if it performed positively for a certain period of time, that it would be safe to say that it was a good thing?
Objection vague as to time. I just think it's went on for a few years, but if you can answer.
I had a feeling that if preliminary results indicated that the implant was doing what it was supposed to do, that the implant would have tremendous possibilities for success.
Okay, but when you're talking about what does preliminary results mean?
Preliminary results could mean anything from a year up.
Okay,